Hi, UNCPN. Happy January, Happy New Year. I'm thrilled to be here with part 3 of our four-part series introducing all of UNCPN to the different parts of UNC Physicians. So we first part of the series heard from Dr. Matt Ewan, the Chief Clinical Officer for UNC Physicians, a little bit about the secret sauce for UNC Physicians, being really strong partnerships, both with a really strong community physician arm as well as a really strong academic physician arm. And then we heard last month from Dr. Susan Moore at Rex Physicians, part of that really strong community arm, about the special sauce and relationship that Rex Physicians has with Rex Hospital and how well they work together to make great things happen for their patients. And so here today, I'm really happy to be talking to Dr. Matt Morrow, who is the president of UNC Faculty Physicians. So thank you for inviting us here and talking with us today.
Thanks for the invitation.
So what would you say when we think about the faculty physicians? What is the special sauce in UNC Faculty Physicians?
Well, I think the academic practice is the special sauce in and of itself. So we have 1,300 faculty physicians, 600 APPs, and over 1,000 residents in this organization. And although the faculty physicians, the UNC FP, represents the clinical arm of the School of Medicine, all of our physicians participate in all of the 3 missions of an academic medical center. So they include not only the clinical work, but they include the research and education. And the way we integrate with that creates that special sauce. In addition, UNC hospitals, actually it's a closed medical staff. You have to be affiliated with the UNC School of Medicine faculty in order to practice here. So we also have a very special relationship with the hospital itself.
Great. Well, thank you so much. I appreciate your time. And one of the things I really enjoy, the partnership between UNCPN and a lot of the faculty physicians revolve around sharing learners and having learners from the School of Medicine, School of Nursing over at our clinical sites, as well as the community-based and practice-based research we get to collaborate on with so many of your excellent academic physicians.
That's been terrific.
It's been wonderful. So thank you so much for joining us this month.
Thanks, Lane.
All right.
Thank you all.
Thank you. All right, so item number 2 this week, want to celebrate. We have market and merit increases coming out this week. We will start to get into the managers will have access to get that information out to all of our teammates. We're really excited this year to be able to continue to recognize all of you for the terrific work that you do. Please note, if you are in a group practice, connect with your practice leadership and your HR business partner to see how this impacts you. The third item is to really make sure we're doing a class survey to see how well our electronic health record is serving us as clinicians and caregivers, as well as our patients. We know our ISD team works tirelessly to continue to try to improve Epic and try to help us take better care of our patients through Epic. And participating in the survey is super important for us to be able to know how well we're doing compared to other national large healthcare system users of Epic. And so please log on in there. It doesn't take very long, and just help us with your ideas and help us know how we're doing and how we can improve in this really, really important area. Item number 4, speaking of the UNC Epic and my chart, I did want to celebrate the work and the changes that went into to Epic back in September to deal with patient medical advice requests. We found that we have seen actually 35% reduction in patient medical advice requests that are coming in with these changes. So I know it doesn't feel like a lot as we practice and as we open our in-basket on a day-to-day basis, but please know we are continuing to dig and work and find what are those additional steps we can take to reduce the in-basket burden for all of us when we take care of patients. I do want to let people know that coming up is the Care for Me Wellness Week that is coming up January 23rd through 26th. And I personally had a great reminder from a patient last week about how important wellness is. As many of you know, my dad has had a long journey with dementia, and he actually passed away after being on hospice for several months at the first of the year. And as such, I needed to cancel some of my patients out of clinic as he was there in his last few days. And I ended up seeing one of those patients who'd been rescheduled last week. And I just shared with her as I started my visit. I appreciated her for kind of understanding and being flexible. And just shared how important it was for me and how meaningful it was for me to be able to be with my dad those last few days. And my patient looked at me in the office, and I've known her for several years, and she said, "Listen, I want you to be clear. I need to be clear with you. If I had known that if you were here last week and I had known that you were sitting here in this exam room talking to me rather than being with your family, I would have fired you as my primary care doctor. I would have fired you because that would mean that you don't know what's really important. You don't know where you should be spending your time and with your family. And if you don't know about that about yourself, how are you going to take good care of me as a patient? And I thought it was such a wonderful reminder from our patients that our patients want us and need us to be healthy and well and to be spending time with our family and our loved ones and taking our vacation and being away from work in a meaningful way so that we can be there to care for all of them. So as you think about the new year, make some resolutions, and I hope that one of those resolutions will be to take some meaningful time to spend with your family and your loved ones. So thank you very much. I appreciate all of you, and take care.